And as it is 8:03, I think I'm going to go ahead and get started. So good morning to everyone on the West Coast, like I said before, and good afternoon for those of you on the East Coast. My name is Allison, and I'm one of the customer success managers at Zencity. I'm very excited to be presenting today with Whitney, Nick, and Jennifer from the cities of Fairfield, Savannah, and Seguin on some of the communications best practices that they've been working on as the coronavirus has been unfolding during this difficult time. I mentioned this before, but I'll say it again for those of you who just joined. If you have questions about anything that's being presented, I really encourage you to take advantage of the Q&A window or the chat bubble. And at the end of the presentation, once Whitney, Nick, and Jennifer share, we're going to be able to address your questions. And if any of you have prepared or want to jump in with ideas of initiatives and programs that you're working on, we would love to hear from you. And I encourage you to participate. So without further ado, I think we're going to get started. So like I said, just some quick introductions. I don't know, our panelists, I would love for you to introduce yourselves. We can start off with Whitney from Fairfield.
All right. Hi there, everybody. Thanks for tuning in. My name is Whitney Skillman, and I'm a communications technician at the city of Fairfield in California.
Great. Nick? And Nick,
Hey, sorry, I was muted. I'm Nick Zoller. I'm the Chief Communications Officer for the city of Savannah, Georgia.
Hi, everybody. I'm Jennifer Sordelia. I am the Public Information Officer at the city of Seguin, Texas.
Awesome. So according to that order, we're going to go through some of the communication strategies that our communications teams have been working on in these cities. And then at the end, we'll have a question and answer period. For those of you just tuning in, again, you can click on the Q&A button or raise your hand, and we'll be able to address all your questions at the end, as well as any ideas and initiatives that you want to share as well. And at the very end, I'll share a Zencity recap for some of the tools and resources that we've put together to hopefully help you as you're managing this crisis. So before we jump in, I do just want to say that we have officially launched this week our Community of Champions, which is a Facebook group that all of you should have received an invitation to. If not to worry. You'll be receiving the recording of this webinar today, as well as a link to join the Community of Champions. Again, like I said, it's a Facebook group, and we're hoping to be able to share best practices with you as, for now, COVID-19 is unfolding. Across communication strategies, also for policy analysis and initiatives. And so I encourage you to participate, and we'd love to see you as part of our Community of Champions. And now I'm going to hand off the mic to Whitney.
Great. Thank you so much. Thank you for having me. And before I start, I want to give a huge shout out to all of the PIOs and all the public information offices across the country. I know we're all really working hard in this kind of new environment to kind of help our residents as much as we possibly can. So I want to commend everybody for all of the work that we're doing. I know I've gotten a lot of information from other people, which has been really helpful. I wanted to first talk about our communication strategy. So our communication strategy has basically remained the same, and that is, as it is for most cities, transparency, information, and inclusivity. However, our strategy has changed a couple of ways. The first way is that we're now using our platform to provide a broader scope of information and resources to our residents. So we're not just focused on our messaging, we're also looking at messaging from other community partners or maybe state or even federal sources. Another way that we've changed or kind of adapted our strategy is using this awesome Zencity platform that we now have access to all of this data. And this is allowing us to be both reactive and proactive. Luckily for us, we kind of have a quiet city as far as reactions and kind of commenting on our social media and stuff. So that can be actually a good and a bad thing. It's good in a way that we don't have a lot of people, like angry people on our social media platforms. But on the other hand, you know, we're also kind of not really sure as far as gauging the temperature of what's really getting through and what's not. So using the Zencity data, we're kind of able to meet our residents where they're at instead of waiting for them to come to us. So one of the things that we have been doing is every Sunday night, we prepare this week over week report. And as you can see, it's a super simple report. This is just kind of how I laid it out because I want whoever is giving the report, my PIO, to be able to kind of just look at the main things that we're looking at as far as on the Zencity dashboard and seeing what she can disperse to other PIOs throughout the city. So the key things that we're looking at are the top 3 official and unofficial trends, both overall and within the coronavirus project. We're also looking at the top 3 official and unofficial sub-projects within the coronavirus project. We're looking at the sentiment and gauging kind of how the city is feeling about the messaging that we're putting out. And we're also looking at the top 5 words in the word cloud. And I kind of like to do this where we have, this week as opposed to last week, so we can kind of see, how things are changing every week. And like I said, this is a super simple way to kind of look at the messaging really quickly, because it's a lot of information. It's a lot of information and a lot of data to kind of sort through. So I think you can kind of drive yourself crazy looking at it every day, but I think week over week, it kind of gives you a clearer picture of what's actually happening with your messaging. From this, we can see also how our messaging is aligning with what our residents are talking about, which is something we weren't able to really do before, which is fantastic. And we can kind of use it to determine what our posting should be about, our messaging should be about for the following week. So if we already have messaging set for the following week, we'll kind of look at what's trending and see how we can kind of fold those messages into the messages that we're already given. So next on our key messaging, our main focus, like everyone else right now, is trying to get information out to our residents and small businesses, whether it's through our services or those of our community partners. So these are some examples of a few messages we've posted. What we're doing is we're trying to combine a lot of messaging, because we know people are being bombarded with messages right now from every source, from everywhere. So, we'll say something like, we want to thank our healthcare workers and we're having testing. You can, if you need stuff to do, you can go to our virtual exercise page, or you can, go to the local library. So we try to do things like that. And we're finding that, I don't know about everybody else, but we try to post to our platforms once a day, which is not that much, but we found that if our messages have the chance to kind of linger longer on a page, that they're more impactful. And also it kind of prevents from posting fatigue, like from people seeing so many posts. Sometimes if there's just so much, they will stop kind of looking at what you're posting. So we find that if we just do it, once a day, that it's a little more effective. And also if some other ways that we're messaging on this one from the school, we're kind of trying to combine, the 2 different school districts in our city with the college in our city, and kind of give like a super, basically cliff note of what's going on, because I know a lot of our residents can actually go to the source for this information, and a lot of them probably are subscribed to the school districts, for example, or the college. But this kind of just gives you like a quick, like I said, like a cliff note, like this is what's happening this week. So, we're going to put it out there while we're saying thank you. We've accomplished basically covering 4 things at once. And then one other thing that we have been trying to kind of focus on is promoting community with our messaging and interaction. And that the mask post that's up in the right corner did really well for us. This is actually the 2nd post. I put it up and I was kind of shocked, but it's kind of like a fun, release and community interaction where people can see what other people are doing with their masks. So when I put up the 2nd post, I actually took screenshots of everyone that had posted their masks and put that up. And then I'll probably do it again this week with all the new people that posted from this post right here. So that is kind of another way that we're trying to reach out to our residents. And then I also included a couple links of how to make a mask, of course. As far as content and channels, we're actually doing a couple of new things and a couple of things that we've already done. Like I said, now more than ever, it's really important to deliver accurate information in the simplest way possible. So the 2 new ways that we're doing this, I kind of already mentioned. The first way is by just reposting information. And like I said, I find that this really helps for accuracy. Since we're posting so much, sometimes if we are putting our own blurb or caption on something, we might make a typo or might not see something just because we're doing it so much. So we're actually just reposting really what we feel are really important notifications from our community partners. Secondly, we have created a working list of links to local, state, and federal resources on our website homepage. This is something that we're updating is, whenever we get new sources. I actually just found a new one this morning for anyone who wants to volunteer in California. There's a state website. So I'll go ahead and put this up here soon so people can, it kind of connects you with people in your area who might need help. So this is also great because it's a subscribable page. So anytime that there's an update, everyone who's subscribed to the page can get an update on that. If you notice on the links, first we just had the links up. We actually went back through and kind of put a little description next to the links because they might just look at the link and go, oh, Solano County, I have no idea what they offer. So I kind of find that this is helpful, putting like what actually is offered through this link so people can just kind of really easily and quickly see like, oh, this is the one I need to check on. The third thing that we're doing is just creating quick little, I use Powtoon and create these little quick animated infographics kind of for things that pertain, of course, I'm sure not only just to us, but to everyone across the country right now. These are going on our social posts, our website, and we are also doing 30 seconds for local TV here. And then fourth, we're sharing weekly internal messaging from our city manager via an unlisted YouTube link. So I'm sure probably everybody is doing this as well, but we find that it definitely, kind of helps ease some of the unrest or the uneasiness among city employees. So these are a few things that we're working on. I hope any of them might give you some ideas or might be helpful to you. And thanks for having me.
Great. Thank you so much for sharing, Whitney.
Sure.
And just to reiterate, if you have any questions for Whitney, please feel free to use the question and answer tab, and we'll address them all at the end. And now I'm going to hand over the mic to Nick.
Sure. So, kind of like Whitney said, things changed very quickly with COVID-19, and we can actually just go to the next slide. So early on, we immediately knew that, or I immediately knew that business as usual was over. So what I needed to do right away was focus not only on how I could protect the city and our department and our organization from COVID-19 with effective information, but also looking at the budgetary side of things. So both of those were going hand in hand with knowing we were going to end up losing revenue. So what we did early on was transition completely away from our 2020 strategic communications plan into a crisis communications plan that governs everything that my department's doing right now. And the reason for that is, one, to have a consistent, thoughtful message going out with key benchmarks and messaging based on where we are during the pandemic. And then on the second hand, also to be able to have more of our staff be FEMA reimbursable to take some of the pressure off of our general fund. So what I did right after we decided to cancel the second largest St. Patrick's Day celebration in the country, I formed a crisis communications plan that has multiple components to it, had multiple steps before, during, and after the pandemic phase. Obviously, we're in the during right now. And then also informed our mayor and our city council that we would not be doing anything else but COVID-19. We can go to the next slide. So kind of like Whitney said on this also, it's important to have a consistent brand image that's going out during any kind of crisis communication scenario. So what we did was really started putting out daily graphics with information that was easily consumed. So every day, people are getting a piece of the information of what's most important based on the data we're seeing from public health officials. Here are some of the key messages that need to get out to the public. A big thing that we've really noticed, there have been a lot of mental health problems. So we've doubled down a lot on messaging toward mental health. We've featured a couple mental health resources through our COVID-19 website as well. Beyond that, we've taken these topics of importance and utilized our best, most that slide's still fine, thanks. Utilized our best, most trusted messenger, who is our mayor. He's very effective on camera, very well known in the community. He's was on city council for 16 years before he became our mayor in January. So every week on Tuesdays, he's been having an open availability for about an hour with our local media, which has been very effective. We've gotten lots of coverage all week, each week, by giving them enough sound to use right up at the top of the week. And then in addition to that, every Friday morning, we record a video with the mayor to post both on his Facebook and the city's Facebook every Saturday at 8 a.m. with a weekly update about what's going on in our community and what actions have been taken by the city. And then in addition to that, we're leveraging context that we've established over time to now have a voice in the reopening of our state. So our governor this week has ordered Georgia to really be the first state to have widespread business openings. So our city council and our mayor have some obvious reservations about that, especially with our community just really starting to get to our apex. And so we've had the opportunity to go out and spread that message a little wider and use some of these key messages that we've been using locally on a more global scale to share why it's important for us to really follow science. Something that we've kind of coined as something that's said all the time is that we're keeping the faith, but we're following the science. So we have faith that we're going to get past this, but we have to be deliberate about how we do so. We can go to the next slide now. So one of the things that we also did up front was ending all in-person city council meetings. And luckily, state law allowed us to do so in an emergency. So our city council initially was meeting via conference call line. We worked with IT to quickly set up Zoom meetings, which I'm sure everyone's pretty much doing at this point, but they've been very, very successful. We've had a lot of engagement on social, especially surrounding these Zoom meetings, hundreds of comments on each meeting and thousands of viewers for each one. It's way more engagement on the videos than we normally get for a typical city council meeting. So we're having updates on COVID-19 on Mondays and Wednesdays in the afternoon, and those are just another messaging vehicle for us to really have all the different district representatives of our city get together and share their concerns and their knowledge, and then have our city manager address any of those concerns. So I think that's kind of where we are, and I'll just hand it over to Jennifer.
Thank you so much, Nick. And Jennifer, I think you're on mute if you want to click on the unmute button. Great.
Better. Okay, I wanted to start by saying I'm not certain about the other two cities that are on, but I'm a one-person shop at my city, so it's basically just me messaging all of these, crafting all these messages every day on our updates and whatnot. However, I'm very lucky that we have a decentralized communication across our city departments. So typically there's a person in every department that takes care if they've got a Facebook page or a web page on our city website. But one of the very first things early on that I did was I developed a set of pages specifically dedicated to COVID-19. I coined it a COVID-19 information center. So every day we get updates from our emergency management coordinator with the county and also with the city. Once I get those numbers, I put the information out there so that everyone can see it out there on our website. And I think really people are concerned right now with how many cases there are in our city and county. So that's the very first thing I put on the page in big bold letters. And I update that every single day. And I also update the paragraph underneath it as well. But I thought it was important also to have some different pages for the community as well. So I dedicated some pages about just general information about COVID-19, put some frequently asked questions out there, helpful resources and links. I also put some information out there for our small businesses that are going through this right now too, and things that they can do to try to help their businesses. Also resident resources out there, and then dedicated a page to news and updates where I put all of our news releases and whatnot so anyone can go out there. and look at those. We also put a link out there for our shopping and curbside delivery. We thought that was important for our residents to know where they can go and get food, or if they want retail, where they can go and do that and order it online and pick it up too. And that helps our small businesses as well. The next thing that I have been doing, obviously, is doing our daily updates and messaging on our social media pages. What we're doing here is we're doing informational graphics, photos, videos, and then we post these to our Facebook, Nextdoor, Twitter, and Instagram. These are just a few of the examples that we've done. You would be amazed at how many people responded to "should I flush it?" when we did that. It was crazy. And people were like, "Oh my God, I can't believe that people actually flush stuff other than the 3 Ps." And so, you know, it was kind of an uplifting message, but also an educational message that we did. So these are some of our examples of our messaging and infographics that we've done, and also a sample of what I do every day on our social media pages as far as our COVID-19 daily updates when we get that information in. So that's been really, really helpful. You can go to the next slide. So just like the other 2 cities, our mayor, he's a fixture in our city as well. He's been our mayor for years and years and years. In fact, this is his last term. He's going to be going out of office in November, so he's very well known. So he has been doing a mayor's message via video, just to talk to our community and engage with them. And we've gotten a lot of good response from our community. They like hearing from him. They like seeing him. And so it's been very well received, and we've gotten a lot of really good input from that. Also, not surprising, during this time, we've seen an increase of followers and likes on our social media pages, as well as a lot of increased traffic to our website, especially on the COVID-19 informational page. I do want to say too, our CVB has done a really great job of developing videos and sharing links, and they actually talked to me this morning. They said they're in the process of doing a new video featuring our mayor, our city managers, some of our local leaders, our superintendent, police and fire chiefs, and other community leaders in short clips. They're going to tape themselves and say what the first things they're going to look forward to doing once we get through this crisis. And so that'll be a fun video that we'll be able to share once we get all of that done. So the last thing, that we're doing too, just like the other cities, is we've started going virtual on our city council meetings. We started broadcasting those on our city Facebook page via Facebook Live. And also we're using Zoom meetings too for our council members. As you can see there, some are tuning in from their homes and participating that way. This seems to be successful so far, and if we have any citizens that want to make comments or participate in any of our public hearings, we ask them to send us an email with their name and their contact information and what they want to speak about, and then we will send them a Zoom invitation meeting with the participant instructions, that way that they can participate that way. We've had a lot of our staff also working from home and working remotely, so we've kind of gone to a virtual meetings, staff meetings for that as well. It seems to be working out really good. Wanted to talk a little bit about some of the challenges that we've had as we've gone through this pandemic. One of the things that we've had a challenge with, we do not have a public health department in our city, so we are getting all of our information from the Texas Department of State Health Services. And that's where we get all of our case numbers. But our citizens, they want to know how many patients, about the patients, contact tracing. They want to know all that information. And unfortunately, our hands are tied, and we don't get all the information that we want from the state. And we get some negative sentiment from our citizens, but there's only so much that we can say, and so much that we're provided with. So that has been a bit of a challenge. They also want to know about the number of tests that have been conducted. And again, that's information that we simply just don't have or are not being provided with. Some of our trending topics on our Zencity dashboard has been public health, social distancing, local economy, public safety, education, and of course, the word pandemic. I did want to mention too, I don't know about you guys in the other cities, but we in Texas have a group of public communicators called the Texas Association of Municipal Information Officers. I just wanted to put a shout out to that group. That has been such a great group to be involved with because we are all sharing information, resources, and some of the challenges that we are going through. We're sharing some of the things that have been working for us or not working for us. And it's just been a really amazing source of support as we're all navigating this pandemic and providing information to our citizens. So that about sums it up for me.
Amazing. Thank you, Jennifer, so much. And thank you to Whitney and Nick for sharing. I believe now is a good time to jump into our question and answer section. I actually have received questions for all three of you. So if you want to unmute yourselves and you can jump in. If anyone from the audience wants to talk, I think you're able to raise your hand and I'm allowed, you're more than welcome to join in the conversation. And once I go through some of the questions, I would also love to invite you to share some of the initiatives. I'm sure there's a bit of overlap and to share your best practices with us. So I'm going to actually jump back up to Whitney and ask your first question. Hopefully this is an easy one. But can you just repeat the name of the infographic animation program that you've been using in Fairfield?
Yeah, I've been using Powtoon. It's Powtoon. It's really easy to use, and they have a lot of kind of pre-built templates that you can use as well.
Great. Is it a free service?
I'm sorry, what?
Is it a free service?
Actually, they have a free version, and then if you subscribe, but I think it's actually a pretty good price. So I don't remember offhand, but you can get the free version or a paid version.
Okay, great. And then one next question for you, Whitney, is regarding the internal communications that you have with employees. How long are your messages and how are you sending them?
So our messages, they go between, I would say, they're under 5 minutes, most of them. Usually between 3 to 5 minutes, and we are just sending them out as an unlisted an unlisted YouTube link to all of our employees.
Great. Jumping over to Nick, a question from Phyllis Banks is, how is information being shared to prepare businesses who choose to open on Friday?
Well, hi, Phyllis. I think you're in Albany, right? That's a good question because, you know, we were kind of blindsided. I'm sure you guys weren't contacted by our governor either. Unfortunately, it's a tough message because right now our city is not really encouraging our businesses to reopen. While the governor's order has allowed them to reopen, it really depends on what's going on in your city, because we know that the dynamics across states are different. So in Savannah, we're definitely encouraging folks to still follow the medical advice and the science and make decisions for themselves. So while they certainly have the legal right to open per the governor's order, and we don't have the legal right to prevent them from doing so, we're encouraging folks to really think twice about whether or not they can effectively follow the CDC guidelines that are still there. And so what we're doing is some messaging, supporting the decisions of local businesses, whether it's to open or remain closed, but supporting them in using valid scientific information for making those decisions. Okay,
great. And I see that, Phyllis, you were raising your hand, so you should be able to talk, and feel free to jump in with your question if you have a follow-up. Gonna unmute you.
Thank you for that insight. We're trying to do the same thing, just kind of let people decide on their own. And I think that's what we're seeing is that people are using common sense to make that decision. A lot of things aren't available for them to actually open, like disinfectants and things like that. So we're taking the same stance. Just want to know, you know, we don't want to be too out forward and blunt about it, but kind of send the message in a subliminal way for them to make those decisions. And like we said, we've had some media cover, talking to salons and stuff like that. And that's been the consensus so far, is that they want to make their own decision.
Yeah, I'd love to connect with you, especially being in Georgia. So if you want to connect after the webinar, I'd love to.
Sounds good. Sounds good. I appreciate that, because it's gonna be tough.
I agree.
Okay, I'm glad the raising hand worked. So for anyone else who wants to jump into the conversation, I encourage you just to raise your hand in the sidebar. I do have a question, and I believe anyone can feel free to jump in on this, but from Jemai Cherry from Beaverton, whether or not anyone can speak to the navigating the challenge of the pressure to politicize messaging, especially in light of this being an election year. I know you mentioned some of you in your mayor updates, your city manager updates, some of them are together. How are you managing this balance?
So I think the biggest thing is remembering that we're the communications professionals and that we need to be able to step forward as leaders and explain why it's important to focus on scientific messaging rather than focusing on what the key political message someone might be trying to push is. So for me, I push back when they try to politicize it because that's our role. Our role is to push back and to defend the integrity of our organizations.
And then, so I guess pivoting off of that, and Jennifer, I'll turn this question to you. Seeing, as you said, you're a one-woman show, even though you do have the support from other departments, what is the balance of communications internally versus externally for you?
It seems to be a pretty good balance for me. I'm not really quite sure what you're asking.
Yeah, so this question also came from Jemai, and I believe it could, the way that I would understand it is the communications that you're doing internally for different departments and the coordination of the efforts for the city of Seguin versus messaging that you're putting out for residents, which you showed us earlier.
I think we were doing a pretty good balanced job of working together to send out our messaging. So.
Okay, great. If anyone else wants to jump in on that, I also have one other question for food for thought from Ido from our team. Actually, is as we're having the challenge of social distancing, what are some of the main challenges you might be facing in moving your council meetings online?
I was just saying, typing my answer to that. Ours was kind of, first of all, getting everyone familiar with using Zoom. Before this, I don't know how many people had ever used Zoom. So, kind of get everyone familiar, getting all the backgrounds, in order so we don't have crazy, distracting backgrounds and that type of thing. And also figure out the best platform to broadcast. We've been using YouTube Live. And we've also been streaming through our on-demand over our website. People can actually look at our channels on demand through our website, or they can watch on our local channel if they have access to that. But it seems like a lot of people are getting a lot more response on Facebook. So, it's interesting to kind of hear the responses you get, by using Facebook Live.
I agree with Whitney. We've been using Facebook Live as our platform. Initially, we had some issues with Zoom. People were saying that they weren't able to hear very well. So we've had to kind of work with our IT department to get that taken care of. But really, that's been really the only, just a little technical problem here and there. But other than that, it seems like it's been working out pretty great. We're a pretty small city and we don't normally have a lot of people that come up and even come to our meetings, but we've been seeing about maybe 100 to 120 people tuning in. So I think, they're watching. I'm hoping that maybe they'll start watching this way if we continue doing it this way too, going forward after we're done with this pandemic.
And yes,
oh, sorry, go ahead, Phyllis.
I'm sorry, right before we really got into the pandemic, we had started live streaming ours. We had a system through Wirecast where we began live streaming our city commission meetings. And right as the pandemic got into place, we had to go full force. So it was a lot of, like everybody's saying, a lot of trial and error. And I think yesterday we got to our highest amount of viewers was like over 1,000. So
wow.
Yeah, it just took time to like work through the trial and error. We were having issues with sound. Finally got the sound system replaced. So I think we're streaming that through our Facebook page, our YouTube page, and our website. So yeah, and our government channel. We're using all of those. I have another question. How are is anybody creating any messaging that targets like maybe 19 to 25-year-olds, those party goers that continue to want to go out and, you know, not really pay attention to what's going on. We put together a little we did a contest for rap, and we kind of hit like the younger teenage folks with the rap, but we're trying to focus on those group of people. So if anybody has any ideas about, you know, messaging for that particular group, I would greatly appreciate it.
We haven't in particular, but I do know that we've taken all of our basketball rims off.
Yeah, we did that too early on. Yeah.
It's kind of a subliminal, well, not so subtle messaging.
Right.
You know, we've done some messaging to some of those groups, Phyllis, and part of the difficulty is I think that age group, we all remember feeling invincible.
Right.
And so everyone, and when you're talking like 18 to 25-year-olds, don't ever think about like getting sick and dying. So what we've tried to do is target messages to them based on the people that they love who could be impacted by them becoming a carrier of COVID-19. So we've had some success with that, with trying to communicate out into various parts of our community about the fact that, yes, it might not kill you, but it could kill someone you love. It could kill your mother. It could kill your grandmother, a good friend of yours who lives down the street who's older. Like, there are a lot of things. And then not to mention, if you're young and you have pre-existing conditions, COVID-19 can kill you.
Right. Sounds good. Sounds really good. We'll look into some of that, but yeah.
One other thing, are you using TikTok? You might want to look at using that as your platform to reach those kids, because they're not really looking at our
I'm on TikTok, but I don't know how the city's gonna feel about it. So I love TikTok. At age 50, I love it, but you know, I don't know how the city's gonna feel about it.
Right.
Phyllis, you can tell them the city of Savannah's on TikTok, so
there you go.
Maybe that'll give you some cover.
Thank you.
We at the city of Seguin, we have not done any messaging to that age group. We need to. That's a great idea. That's something I haven't even really thought about doing. And we're in a college town. We've got Texas Lutheran University in town. So I mean, that's we need to do that for sure.
Right. That's been our challenging group here in Albany. You know, as we prepare for, you know, a possible second wave. Yeah, that's the group that we are very, very concerned about. So yeah.
I right before this, I was in a meeting about just this, and what we're looking at doing is working with some of the youth-oriented groups in our city to collaborate on creating content, and also getting the young people involved in those groups to help share that content. They already have those connections, and their peers are going to trust them more, and they're going to be able to share it in a way that is much more authentic than someone in their 30 plus age group trying to make those connections.
Yeah, if you guys have a PAL group in your city, that might be a really good resource for that.
Sounds good. Sounds really good.
So then just jumping in there in terms of targeting different age groups, going out into that idea of other types of messaging, has there been any requests, and if so, how are you dealing with it for non-COVID communications? Because, you know, city operations are still continuing with or without COVID-19, programming may be continuing. How are you continuing to communicate that messaging out?
I know for us, we haven't necessarily had any requests, but of course, you know, the business of the city must go on. So like I said, we usually will try to fold it in with something maybe that's COVID related, if we can kind of get two messages in one. But, you know, we are, you know, for example, you know, we did a graphic that just says, you know, Public Works is still open. You might not be able to walk into their office, but you can still call this number for all of these different services, you know, and then like, that's something that we'll put off maybe on a day when it's kind of a slow social posting day. We can kind of fit our messages in that way.
So we've had some, Sorry, go ahead, Jennifer. You're
I was about
good.
to say, we've had the same here. We haven't had any really request for any of that messaging other than COVID messaging, but I typically like to put stuff out there, you know, that, yeah, the city is still, it's still business as usual. We're just doing it in a different form or fashion. So, you know, I try to do a project update, maybe update on an engineering project or a capital improvement project that's going on, and post like a little update about that. That's what we've done.
So we have had some major projects that have gotten started during COVID-19. So we've kind of sprinkled in some really important messages. I'm just being very discerning about what we do that's not COVID-19 related. But much like Whitney and Jennifer in their cities, we have communicated about how we're still functioning as an organization. And one of the things we've done is used one of our videographers to go out and highlight the ways that departments are still doing their jobs. So whether it's sanitation or IT, they're both still working. And how are they working? So even showing our employees working from home and what they're doing and how they're benefiting our community. And that's been pretty successful too.
Mm-hmm.
Great. It's great feedback. And I do want to call on Tiffany Wright from the city of Pasadena. I see you're raising your hand, so feel free to ask your question.
No, I was just going to follow up on the other topics other than COVID-19 that our city is trying to push. A huge initiative for us before COVID hit was the census. And so that's been extremely big for us, trying to get as much of an accurate count of our population as possible. So, you know, we're lucky here in California where we have multiple agencies, including the governor's office, that's still pushing out census related information. So we're still piggybacking off of some of that messaging, and also, you know, just reminding folks every day through our social channels to go online, complete the census form while they're safe at home. They can do it contactless, through the phone, through the mail, online. So that's the messaging that we're trying to push right now, in addition to other ancillary messaging in regards to wildlife. We've seen an uptick in coyote sightings in our community, especially because so many people are staying at home. You know, they may be, you know, overloading their trash with food, and so coyotes are coming onto their property and what have you. And so we're very much working alongside our Humane Society, trying to get information out to residents in regards to coyote safety and how to keep coyotes off property. But for us, the main thing, in addition to COVID-19 messaging to the community, has been the census right now.
I agree with you too. We've been doing the same thing as well, just trying to remind people, yeah, you know, while you're at home, now's a great time to participate in the census. And then tomorrow, we have partnered with our local hospital and a food bank in a neighboring community. We're going to have a mega food distribution tomorrow, a drive-through. And so we are putting little flyers in every package of food that people are going to get tomorrow. So that will help remind them, hey, you know, take the census. It helps support programs such as this one that makes the food available to you. So, you know, please participate.
Yeah, and Jennifer, and to anybody else on the call, the census has a really great feature right now on the website, so you can gauge the response rates.
Yes, it does.
Community. And so we've been pushing that as well. I check that every day.
Right,
and so
we have too.
Yeah, and I remind people, okay, we're at, you know, 51%. Okay, you guys are doing better. We're now at 54%.
Right.
And that's been very helpful in getting the community to respond to the census online.
Great, thank you, Tiffany. And I'm really glad that you brought up the topic of the census, because I think it's a very important one that you said pretty much overlaps directly with COVID-19. One question I actually wanted to ask the group, and anyone from who's participating, feel free to jump in on this, is a lot of the focus so far has been on a lot of output and messaging and ways that you're trying to touch base with your residents and communicate your messaging. And so we're wondering how you are continuing to listen to the feedback of your residents, listen to their questions, and if maybe any new channels are emerging in that feedback process.
our local hospital just had I think it was a virtual town hall meeting to kind of get feedback. And we were asked by one of our commissioners to sort of set up something like that to get feedback from the community as well. So that's probably going to be something we're going to look into, about how to do a virtual town hall meeting.
Have you been getting requests, and this could be open for anyone as well, have you been getting requests from residents for virtual town halls, for chances to engage virtually?
We haven't, but on the note of listening to residents, we're still certainly reviewing what's going on Zencity. Obviously, that's why we all have the platform. And then in addition to that, we're way more active in responding to pretty much every single one of the thousands of questions we're getting on social media. And I'm not even exaggerating when I say thousands. It's been a lot on my team, but we're very committed when there's a legitimate question to answering it. And when we're having a lot more engagement with our online trolls right now as well, because they're spreading misinformation, and that's not something I'm willing to accept at a pandemic.
And how are you identifying those misinformations?
So honestly, just having to review the comments directly when we see them in real time. For instance, I had a guy yesterday, I mean, I'm not sleeping a lot right now because we have so much to respond to. So this guy, on every post we did yesterday, posted that the death rate for COVID-19 is 0.07%. In Georgia, it's over 4%. So information like that ends up misleading members of our community to think that they don't have to worry. And really, I mean, I get that 96% is a big number, and it sounds like, oh, okay, most likely I'm going to be fine. But 4% is a pretty big number too when you're talking about fatality.
Like I said, we don't really have, you know, a lot of response on our social platforms. You know, we have a few here and there, but like I said, this is where we're really relying on Zencity kind of to gauge the sentiment and see how people are feeling about what we're posting and putting out there. So, but we haven't really had a lot of requests either.
I'm using Zencity also to kind of monitor that, and then also I'm monitoring the conversations, just as Nick is doing too, and responding to all of those questions that people are having.
And so as you're getting questions from these different streams and channels, and you have multiple departments, multiple touch points throughout your cities for residents, have you had any issues, or what is your greatest challenge in coordinating that messaging on a unified level to your residents? And then also maybe even balancing that out with county data, county outreach efforts, and state efforts as well.
Our greatest challenge is probably a couple of our public facing safety departments have way larger followings on their social platforms. So their messaging is kind of dwarfing our messaging. So that can really kind of be difficult, you know, because they're, you know, trying to push out their own messaging about what they're doing as departments, and, you know, messaging that we're trying to push out to the citizens and the residents at large is kind of getting lost in that. So we've basically been specifically, you know, trying to meet and make sure that we're all sending out the same messages. And sometimes it's even just something as little as sending them the actual message with the blurb saying, hey, can you please make sure you post this one because it's really important. And we've had good success with that. You know, everyone kind of just gets caught up in their own messaging right now. But unfortunately, if we have a smaller platform, then our messaging is getting lost a little bit. So that's a challenge that we're facing.
And I did notice that Molly Onifer raised her hand. So if you would like to jump in, you can now have permission to speak.
Awesome, thank you so much. And I'm calling from the city of Pittsburgh in Pennsylvania. So this is something that we actually did a good job at staying ahead of with just, it was actually like a pretty rudimentary solution when we saw that we were getting different things in all of our different, different questions, or same questions in all of our different communication staff, whether it's 311, our departments each have their own communication staff, public safety has their own PIO office. We just created a shared spreadsheet of some of the FAQs we were getting. And because we also don't have our own public health department, it's countywide, and we were going off of the state and the federal being able to answer all those questions with different links, it was great to have that all just in a spreadsheet that every communicator had access to so that they could just copy and paste the message to answer those questions.
Great, Molly. I think that's very proactive. I'm actually going to jump to the next slide because what I have here is a list of Zencity COVID-19 resources that we've created. And that made me think of our COVID-19 Daily Digest. So more on the reactive end, what this digest provides is your ability to monitor the discourse that's being put out on official channels. So while you might only have purview or access for specific city accounts, perhaps you're the city's main account and you don't have PD access or Parks and Recreation, for example, you're able to still monitor the output from these other departments in one aggregated spot. So I think, Molly, it's really good to have that on the proactive end. And then I personally think that the Daily Digest is a great way to get the reactive side, maybe to tip you off to the proportion of where the discourse is coming from if you have not yet identified those channels. So I'm gonna keep just for the sake of time, because I see we have about 5 minutes left, and I wanna be respectful of everybody's day. I am just going to pivot to some of these additional resources that Zencity is working on providing. I would love to hear your feedback or questions or additional ideas that you might have for ways that we can help you during this time to manage this crisis. And so one of the ways that we're trying to help make it easier for you to follow some of those key resident issues as they're emerging in real time is through your dedicated COVID-19 projects dashboard. And so that's within your dashboard, you're able to access one project specifically on all discourse around coronavirus. However, we have identified key issues and resident pain points, such as at-risk communities or hospitals, testing, community initiatives. And so you're able to see in relation to each other the effect of the discourse and the proportion of what residents are talking about on your channels and also on unofficial channels. And I think Whitney's report in the first slide kind of is a really great way, and I'm excited to share this with everyone, for you to be able to do a side-by-side comparison analysis on that. And I mentioned this in the beginning of the presentation, but we also have the Zencity Community of Champions. Kind of following the conversation from today's webinar, we would love to have a more 24/7 accessible platform for all of our Zencities, our communications, PIOs, and our policymakers, analysts, to be able to communicate and ask those questions. So I really encourage you, and again, you'll get a link to join the Community of Champions just to keep the conversation and the questions going, because I personally have learned a lot, and I think that best practices and sharing of ideas and initiatives at this time is probably the best thing that we can do. And then lastly is just to check out the Zencity Help Center. You can access this right within your dashboard. We also have a link to the Help Center, which I'll also share with everyone who participated today. Which we have designed to help you target some of your key questions around messaging and resident feedback on managing the coronavirus crisis. And with that, I believe I have about 3 minutes left for any additional questions. Thank you so much to Jennifer, Nick, and Whitney for preparing the content, the slides, and the amazing work that you're doing. And thank you for everyone today for sharing your ideas. And hopefully hopefully we're in this direction of soon, lightening these restrictions and the next challenge being reopening, hopefully soon when it's all safe. I would love to bring us all back together and as we re-tackle these challenges from a new perspective.
Thank you for having me.
Great.
Thanks, Allison.
And if anyone wants to send any additional questions, feel free to contact your dedicated Zencity Customer Success Manager. You can contact me and you'll receive an email tomorrow with all of the content and a recording from today's webinar. So thank you everyone for joining.
Okay.
Thank you.